Coming up on this episode of Learn from People Who Lived It. Were there ever moments where you were like, cancer, I'm gonna die? Or did you never entertain that?
No. I was just like, okay, this is my path.
It starts to get messy when it's like, is this depression or, are you still just experiencing grief because you just lost, your parent 2 months ago, right? Like, we don't want to medicate that. Like, we need to work through that. That's a natural part of life that we kind of need to figure out how to work through.
That podcast is coming right up. First up, let me tell you about a couple of our resource partners. So almost every week of my life for the last 2 years, somebody will ask me about the retreat that changed my life. And I'm so proud to present Spirit Quest as one of our official resource partners. Founded in 2007, it's the holistic wellness center that changed my life, helped me overcome anxiety, helped me work through conflict, gave me all these tools to manage stress, and they would love to do the same thing for you. To connect to Spirit Quest, click the link on our resources tab at learnfrompeoplewholivedit.com, and when you get on the phone with them, make sure you mention that you heard it on Learn from People Who Lived It. At Mental Joe, they sell more than shirts. They sell apparel with a purpose. In fact, my favorite hoodie in my closet is a Mental Joe hoodie. They help out GI Joes to the average Joe's one t-shirt at a time. With every purchase, you help them support organizations that can provide services to help others get out of their heads and into their bodies through plant medicines, equine therapy, yoga, and other non-traditional mental health treatments. Link to them. Pick out your favorite t-shirt or hoodie right now at learnfrompeoplewholivedit.com/resources. One of our proud resource partners is Eric's House. Here's the deal. Nothing quite prepares us for the heartache of a profound loss. And grief isn't a problem to be fixed, but rather a normal reaction to loss. So when somebody you love dies, it might feel like everything you once knew is true has changed. When we experience that loss, especially the ones that are really unexpected, like suicide or addiction, grief is complicated. That's where the community at Eric's House comes in. Link to them on the resources page at learnfrompeoplewholivedit.com.
Find Learn from People Who Lived It wherever you get podcasts. Search it using all one word. Learn from People Who Lived It.
Welcome to another episode of Learn from People Who Lived It.
Hello, everybody. This is Dr. Kimara Vaughn. Everyone calls me Dr. Kimara, and I'm 48 years old.
All right. What story are you here to share today?
How to navigate the U.S. healthcare system without losing your mind or your sanity.
Oh my goodness gracious. Who do you hope hears this?
Anyone and everyone that will have interactions in the healthcare system, which is all of us.
Okay. I don't know if that's what I expected to hear, but I am damn delighted to get into it. Let's bring Dr. Frank Bavacqua into the party right away. How are you, sir?
I am good. How are you?
I'm awesome, except when I have to deal with the healthcare system. She's right about
it's awful. Yeah.
It's awful. It almost feels like you're set up to fail unless you just link on to that one system or that one practice or that one clinic, that just seems to get it and really work with people and be cool and understanding. But you're right. It's tough.
Yeah, the whole thing just seems harder than it needs to be. So, let's hope we learn some good stuff today about, what to do and what not to do.
Well, Dr. Kimara, welcome to the podcast. I know that you're here because you've had a few situations that have led you to have to deal with the healthcare system, and that is where I'm sure some of the journey starts. But you know how we like to roll on this podcast. We like 0 to 10. I like to get a really good snapshot at the way you grew up, mom, dad, family dynamics. What's your ACEs score? Let's get to work here. What are we doing?
Well, I guess you would say my life has been between 7.5 to 8. Most of my life. I grew up as an only child of a single parent due to divorce. So my mother was very strict. I had to get good grades. Not getting C's was not acceptable. And I was an athlete. So she put me in any sport I wanted to. I started off with it was gymnastics first. I over-rotated, fell on my chin, knocked out some teeth, so no more gymnastics. Then I ended up in martial arts, I think 7 or 8. And then pick every other sport that came along after that, I did it.
So wait a minute, hold on. Gymnastics was, turned out to be too I guess we'll call it violent. So then you went to martial arts, like that was the progression there.
Yes.
Okay.
It was still my
I'm just making sure I understand. I'm new here.
No, it makes perfect sense to me from like a parental standpoint. You seem like, you know what? We need to teach her to defend herself. She needs some more tools. We're going to make sure. No, I love that. So what were you like one of these kids that was in like a little store in the strip mall and you were taking classes 5 nights a week or something like that?
I could barely remember. It seemed like I started, I think it was either karate or taekwondo. And then I would stop because I would get into another sport. Because growing up in Texas, I played tennis, volleyball. Then there's this badminton. I'm like, why was I playing badminton? Never did basketball, did volleyball, but my bread and butter was track and field.
Love that. What about your father? You mentioned a divorce. How involved was he in your life?
He was not involved at all. It seemed like they got divorced and he dipped out, got into another marriage, had more kids. So he was very uninvolved most of my life.
Most of your life.
Yeah. He tried to wiggle his way back in a couple times. And being a kid, when you have a parent that lies to you all the time, my mother never badmouthed him. She wanted me to figure it out for my own self, like my relationship with him. And when I realized, I'm like, he's lying again. I'm like, I'm done. And that was 14 years old. And my mother's like, okay, she made her decision.
I love that. I want to ask Dr. Frank Bavacqua to come in right away because of what she just said. When it comes to like these tough conversations, divorce or whatever it is, right? We is it better to let kids figure it out on their own, or do you want mom and dad to be in your ear all the time? Because I think you're onto something there, Dr. Kimara.
Mm-hmm.
Yeah, I mean, in no world do we like. First, two things. One, it's real confusing to get, contradictory messages from two different people. And two people, if we're talking about parents, two people that, should be safe people, trusting people. So that like hearing conflicting messages from one or the other all the time, not great. It's also not a real comfortable feeling to hear, bad mouthing, we'll call it. Some people will go so far as to call it like, I heard someone earlier today call it kind of poisoning. He was referring to his ex-wife, saying that his ex-wife kind of poisoned his kids against him. And, he's like, my son kind of saw through the poisoning, but my daughter hasn't yet. Right. And hopefully she still comes around. Yeah, I just feel like eventually nobody wins in that scenario, because if you do kind of like see the light eventually, then you're mad at the parent who fed you all that stuff all along. So like it's a no-win scenario.
Does it feel like a no-win scenario for you, Dr. Kimara, being the person that went through it?
No, I didn't see it because he wasn't there, and I didn't try to engage, and he would only engage when he wanted something.
Yeah. In your situation, like it seems like your mom didn't have to say anything, right? Like you could see with your own eyes what was happening. And that's kind of what I mean. Like the bad mouthing is kind of the no-win scenario. But if you just kind of like, I've known a couple of people who just kind of like, they lay back and they're like, my kid is going to figure out sooner rather than later which parent is here for them and which parent is not. And I don't need to like tell them or remind them. Like, when birthday rolls around, we're here celebrating and someone else didn't call, like we figure that out.
Exactly.
All right. So you grow up, you go through high school. I mean, at what point in your life do you decide, like, I want to be a doctor? I want to go down that path of learning that much information? Because I applaud you guys. I have a huge amount of respect for people that have that kind of patience to go through that system, because it's like, I went to college for 1.5 years and that felt like an eternity. You guys are in there 5 times as long. So what point in your life do you decide you want to move in that path?
Here's the kicker. I was 5 years old and the family was like, okay, hence not going to college is not an option. can't get C's. That set the foundation for everything because I said I was going to be a doctor. So I went through high school. We moved from Texas back up to Indiana my senior year, which about killed me. And applying to schools, my mother had said, oh no, she's out of state everywhere because we had just moved. I ended up getting early admission because I applied to Purdue because I didn't have to pay any fees or write any, what were those things? Statement.
Yeah, the admissions essays. Those things are awful.
Right. So I didn't have to write one for Purdue because I was sick of writing it. So I just sent it in, went on with my life. And I was accepted Thanksgiving. The letter showed up that day.
Well, happy Thanksgiving to you.
Yeah. So I got in. I'm like, woo, Thanksgiving, let's go over to grandma's house. And we told the family I got accepted to Purdue. They're like, it's not real. I showed them the envelope with the thing and they're like, wow. So I got early admission, went to Purdue for 4 years. I was pre-med psychology major because instead of being a doctor too, I wanted to be an FBI profiler.
Whoa, really?
And psych major. Oh yeah. I wanted to know why people did what they did.
Amazing.
Criminal wise. So I did that, went through the rigmarole, applied for graduate school to a school in Boston, made it to the final cut and didn't get in. So I was like number 11. But the weird thing is I found out from that process, they're like, yeah, you didn't come to us for undergrad. I'm like, I didn't get in. And they're like, no, you did. So apparently there was a letter that didn't get to me. Because even my mother told me, she said, had you gotten that letter from that school, you never would have went to Purdue.
Wow.
So it
all unfolded for a reason.
Yeah, my life went a different direction because of an acceptance letter. So I graduated, had no job. I'm like, oh, Lord, what am I going to do? And I'm like, I need a job. I'll go back to school. That's when I went into nursing at Purdue. I got in really quickly, and I went and got my nursing degree from my alma mater.
Okay. So what were you hoping to do with all of this?
Well, nursing, it was, to be honest, it was like I needed a job and I knew I could get a job.
Okay.
Really quickly. So I was accepted 9 days after graduation from my nursing degree to a job in Phoenix, Arizona. So I was about to move. So it was that trajectory. And I knew I could still do psychology, mental health, being a nurse.
Then some things happen because now you're a naturopathic physician. Is that correct?
Yes.
So help everybody understand let me just be straight. Help Frank understand what that means. So we can just clear this up for everybody listening. We hear it all the time about naturopaths. What does it mean? It's for my sake too, I'll be honest.
Okay. Cliff note version. A naturopathic physician, we do go through naturopathic med school. It's kind of a mirror of conventional med school, but it includes a lot of the naturopathic modalities in there, like nutrition. We still do the physiology, micro, cadaver lab, all those other classic things, but then they add in nutritional medicine, environmental medicine. There was traditional Chinese medicine in my training. And I think I said homeopathy. There was botanical medicine. There's so many different things that we were taught at the same time. So you're going through that and you still have to do rotations. When you graduate, you have the opportunity to do residency, but there are not a lot of residency spots. So I was already a nurse practitioner. So I'm like, I've done my residency. So I already knew what I was going to do. But a naturopath, just think they're a doctor that treats people using what used to be the old medicine before conventional medicine came in. We focus on nutrition, restoring back to health, allowing the body to heal, and many other things. Sometimes we use pharmaceuticals. Other times we may be using herbal medicine, hydrotherapy, saunas, and many, many other things. We're the ones that ask you, what's your diet like? How are you sleeping? What's your stress? We ask questions like that, and people like, no one's ever asked me that before.
Mm-hmm. You also say poop in a basket so I can send it to a lab and they'll tell me what your gut biome is. I've been down this road before many, many years, and I love it. I really do. I'm such an advocate for naturopaths and how they approach healing and how they sort of have this mindset of let's stop just working on the symptom. Let's try to figure out where it's coming from. Let's get to the root of the matter, and let's put your body in a position to heal itself. And, we kind of lose sight of that. And Frank, I want to bring you in here, and you're going to be like, where's the parallel? But just hang out with me for a little bit of a second. Okay. So how can we equate that to psychology and what you do? That idea that we can put the body in a place where it can heal itself. Is that possible from your vantage point when it comes to the things that you have to treat a lot, depression and anxiety and people that just have everyday life problems? Can we put the mind in a place to sort of heal itself?
I mean, in a lot of ways, there's a parallel with psychology and psychiatry, right? I mean, psychology is a lot about, what are the skills that you have? What is your environment like? What situation are you putting yourself in? How are you responding? It's a lot of skill-based stuff that people can learn and change. Psychiatry and that's a lot of people don't know the difference between psychologist and psychiatrist. The psychiatrist is the one who can potentially prescribe medication to somebody who's in a situation that might need it. And there are lots of times where that is necessary. And a lot of times it's necessary potentially as like a baseline, and it helps somebody improve or feel better just enough so that they can work on all of the other kind of systemic things in their life, right? The skill-based things. And then, of course, there are times where medication, your kind of traditional pharmaceutical medication is not the best answer. It's an answer. It masks things. But, it starts to get messy when it's like, is this depression or, are you still just experiencing grief because you just lost, your parent 2 months ago, right? Like, we don't want to medicate that. Like we need to work through that. That's a natural part of life that we kind of need to figure out how to work through. And I imagine, physical medicine is much the same way. There are times where pharmaceutical intervention might be kind of the necessary thing, but there's a lot of things that we can do without that put our bodies in a better spot. You tell me if I'm picking up on this or not.
No, it's good.
Beautiful job. Thank you very much. So, Dr. Kimara, I know that when you started, you hear I got some things to say about the healthcare system and ways that we can navigate it. And I'm not looking for a bash session, and I'm sure that's not what you're here to provide, but you are here to help people understand what they can do better. So before we get to that, how did you come to learn all of this stuff? What was your big life event that you would face off with that would put you in a place where you needed to learn these skills?
Yes, after 20 years of working as an ICU nurse or nurse practitioner, whatever, I was diagnosed with breast cancer in 2022. So my whole life, nothing going wrong, and then the hammer drops. And now I was thrust into a system that I worked in. So I got to see it from the consumer side, I guess you would say, instead of the giving it. So it was that diagnosis on St. Patrick's Day in 2022.
What is it with you and holidays?
You get
the good news on Thanksgiving. You get the bad news on St. Patty's Day. What happens on Christmas?
Nothing.
Oh, okay.
I always worked on Christmas, so I couldn't get any bad news.
All right, fair enough. So how old were you when you found out you had breast cancer?
I was 46 because my birthday hadn't swung around yet. So I was 46.
Okay. Give me your opinion really fast, just briefly, on shifting the age in which we test women. I've done a lot of work in my radio career with women in breast cancer, and I feel like almost similar to the prostate cancer, it's probably time to push things back just a little bit. Where are you on that as somebody who got it in her mid-40s?
I agree. I talked to my women's health provider because my mom had breast cancer, and the year before I told her, I said, hey, what year should I start? She said, 40, because you don't have a family history. Well, because my family history occurred the next year, it was now like 35. So we were doing yearly mammograms from the time I was 35. So it was 11 years of mammograms, and the last one was the one. So I was like, okay, I still think it should be lowered a little bit because you're having more and more women who have no family history, because we didn't have a family history in my family until my mom. Most women are being diagnosed younger, and there's no family history at all.
How did you come to find it?
Oh, it was on a mammogram. It was through a mammogram. It wasn't self-detected at all because it was deep, but it was via a mammogram, and they called and said, we need to do a biopsy. I'm like, oh no, biopsy, I'm going to have a panic attack. But it was a different kind of biopsy. And this is the part of the healthcare system. It's like when something needs to be done ASAP, you could get in fast, especially if they're about to do a test. You could get in fast. So, and that was St. Patrick's Day. I'm like, okay, yeah, I'll go. And that was the day the results, I found out a couple days later, but the results were positive.
So yesterday I had the privilege of being in on a podcast recording for this cardiologist friend of mine that I work on. And it's interesting that we're getting into this today because he got real sick from COVID and, he survived, but it was a real battle. Long story short, he kind of gave up this information about how he was a doctor and that allowed him to go through the experience of having COVID very differently than like me going through it, not knowing a damn thing. Mm-hmm. You going through your cancer diagnosis as a highly educated individual, did that give you a severe upper hand? And if so, how so?
It could give you an upper hand, but it's a lower hand because you have so much information. Because you know B cell lines, T cell lines, you're just like, oh, I'm at risk of all the information I know. So that's why I was leaning on my team. It's like, okay, what do I do? He tells me I have breast cancer. I didn't even get a chance to think, oh, Lord, I'm going to die. He said, nope, we caught it early. It's very quick. And I was like, oh, so I didn't have time to think of, oh, I'm going to die, because his next sentence after he said it's positive, this is not going to kill you, blah, blah, blah. You're going to go see the doctor. And I was like, okay. So I didn't have time to get in my head about everything. I was just going to take it in stride, especially he said, we caught it early. This is survivable. So I'm like, oh, okay. I didn't have to go down the rabbit hole of, oh no, I've got 6 months to live or something like that, depending on what the prognosis is.
It's interesting. And your mindset probably contributed to this whole experience, because some people like Frank, we've had, 100 people on that have been diagnosed with cancer, and that moment is never very attractive. But you have this sort of, okay, got it, but my doc says I'm going to beat it, and here we go. Like, were there ever moments where you were like, cancer, I'm going to die? What's my life? Or did you never entertain that?
No, no. I was just like, okay, this is my path. I get to live through it, tell people the crazy stuff that occurred, if anything occurred. I'm like, all right, I'm on this path now.
Okay.
See how it goes.
I can promise our listeners that comes from a lot of her training with Buddhism, and that idea that you've just been shifted to a new path, and that's the one you keep walking. Am I incorrect about that?
No, that's correct. Because I did pull out one of my Buddhist books, and I started flipping. I'm like, actually, I don't think I flipped. I think I dropped the book and a page opened, and I picked it up. And then there was a phrase. I'm like, I'm going to be all right. Because this phrase says, I can't even remember what phrase it was, but I do remember picking up the book and dropping it. For some reason, I thought I flipped through it, but I distinctly remember dropping the book.
Okay, so here's an interesting thing to talk about here, Frank, right? Faith allows her to get into a mindset where she feels like she's going to be okay. Yeah. So somebody who gets a cancer diagnosis that doesn't have a faith similar to hers, what are some tools for them to maybe again, put themselves in that place where they can step into this mindset.
Yeah. And because I'm immediately thinking like, I like to think of myself as a fairly positive, optimistic person. And eventually I can come around to like everything happens for a reason, or like things are going to be okay. I don't know because I haven't been in that seat yet, or hopefully ever. But I just don't think I would immediately be like, okay. Like I don't think I would just be that like trusting, you know? And so I'm trying to think like, okay, if I were in that spot, how would I get from that point A to point B? And I come back to the same thing that I've shared with, you know, other guests in the past, like having some kind of community around you that can support you. And that community is going to, in this case, consist of, you know, professionals who are doing a certain job for you. And then people in your personal life who can be supportive, encouraging, take other stresses off your plate. Maybe it is really, really hard and super rare to accomplish big, hard, scary things completely by yourself. It's just really, really rare.
Mm-hmm.
Speak to your community, Dr. Kimara. What were they like for you?
Oh, they were fantastic. When the radiologist was the one who called and tell me the diagnosis and no, you're not going to die. And he's like, do you have a surgeon in mind? I'm like, I wasn't planning on getting breast cancer. So of course I don't have a surgeon. I said, well, who do you recommend? So he gave me a name and I'm like, oh, I think he's on my list. I'm like, okay. So then I get a phone call from my women's health provider. I've been seeing her for 20 years. And she was floored. She goes, this is the last thing I wanted for you, blah, blah, blah. And she said, who are you going to see? And I told her the name of the surgeon. She goes, yes, good. That's who we refer people to. So I'm like, okay, I got 2 for 2. And then other doctors I talked to, I had mentioned the surgeon. They're like, good, yes, number 1. I'm like, okay, I got a good surgeon. So I was in the surgeon's office within a week. And he, again, drawing diagrams and stuff, telling me this is you're not going to die. He told me about the stages, what they're going to do, what the surgery would be like. But first, you have to do genetic testing and we have to get an MRI. I'm like, seriously, more stuff? Because you think you get diagnosed, you're going to have surgery, go through radiation or chemo, everything would be great. And because of my age, being under 50, that's where genetic testing comes in and MRI to see the actual location. They knew the location, but they wanted to make sure there wasn't anything next to it.
I wonder what you could offer the audience right now, because, you know, the title of this podcast will probably have some reference to your breast cancer diagnosis, and that might bring folks in. And maybe there's a woman who's just found out she's got cancer and she doesn't quite have your attitude of like, hey, it's going to be okay. What kind of peace are you able to offer somebody as somebody went through the process to be able to say, well, listen, just put one foot in front of the other. This is going to come. This is going to come. Do you mind speaking to that a little bit?
Yes. Take the steps. Don't try to go from A to Z. Go to A to B, B to C, C to D. Don't try to go down the road, because I did get caught up with, okay, why do I need to do that first? Can't we just do the surgery? Because we know we need to have it. But that was like step 12. I had to get through all those other things first. And then that's the other wrinkle with the healthcare system. And it could be post-COVID because a lot of imaging places were paring down what they were doing. So you weren't going to get an appointment in 4 days. It was 2 months. And I was like, okay, I guess it's a good thing I'm not dying, because the appointment for the genetics counselor was almost 2 months in advance. So I'm like, okay, I'll take a trip to Mexico because I'm not going to sit around and do nothing. So I did that, came back, had the MRI, which led to a panic attack. And then I reached out to another colleague. I'm like, hey, I need help, because this was not what I expected. I literally lost my mind. Yeah. So, and I ended up taking a homeopathic preparation in addition to what I was already taking, and that worked like a charm.
What is that?
I already knew I needed to take aconite because that fear, heart racing, I felt like I was on fire. So I was already taking aconite, but then when I got there, another symptom showed up I never had before with an MRI machine. And I was like, oh, this ain't going to be good. So we couldn't do the MRI that day. They rescheduled it for Friday. I was there on Tuesday. I knew what remedy I needed, but I didn't have it, and I couldn't get it delivered to me quick enough. So I called the colleague who has these in stock in her office. So I reached out to her. She said, we have it. I picked it up the next day. She had asked, how are you taking it? I told her. She said, take it like this, and it worked like a charm.
What are we talking about? So don't you want to know too, Frank? Like, what are you taking? I'm so curious.
It's homeopathy for I'm trying to remember, severe panic attacks. I felt like I was on fire. My heart was racing, impending doom of immediate death. That's
right.
aconitum. So my remedy was aconite. I already knew to take that. But I also had other symptoms of panic. I couldn't even look at the machine. I had to walk in there with my eyes closed because just seeing it would send me into a tizzy. And I figured out that remedy is argentum nitrum, that's silver nitrate. So that's what I called my colleague for, because I needed that remedy. Because I had Valium, yes, but Valium was only going to chill me out. I needed to get the mental part wrapped around me. So I took those two remedies the way my colleague told me to take it the day before, and then the day of, as my friend were driving me there. And tell you, my friend was like, how much Valium did you take? I haven't taken the Valium yet.
Yeah.
It's just the two homeopathic remedies.
Well, I'm putting our disclaimer at the bottom of the video feed right now that suggests that anybody who's in this similar position consult your doctor before you take anything, please. We'll want to make sure that you do that responsibly. But yeah, no, I'm just so fat because this is the part of what you do that's so interesting to me, because I remember going through all my stuff with my gut, and I went to the doc, and she was like, okay, so we're going to do some magnesium, some vitamin C. And then we did this other vitamin C trick where I like took as much as I could before I just crap myself all the time. And, sort of figuring all this stuff out. And it was such a different approach than my primary care doctor would have given me, right? It would have probably been something like Zantac and some other stomach something to calm everything down. And it was fascinating because within a period of time, I was able to just put my body in a place where it could heal itself. And I think that's what's so cool. Let's move into the healthcare piece of this conversation, because I feel like there's some things you want to say, you want to get off your chest. You want to make sure that people understand that are going through this. And I'll give you an opportunity to do that. Frank, jump in whenever you want. Okay.
Are you ready?
Dude, dive.
This is what I've been waiting for the whole time.
This is it.
Okay. First off, you are going to compile a team. There's one member of your team we all hate. That's your insurance company, but they're needed if it's there. You're going to call your insurance company when you get your diagnosis, or if you have a chronic diagnosis, because you need to call them to ask, hey, what's covered, what's not covered? Is this doctor covered? Is this hospital covered? Is this surgery center covered? What's my deductible? How much is left of my deductible? How much is this medicine going to cost me? Call and ask them all those questions, because if your health insurance is through your employer, you may not know everything your insurance may cover or not cover. So calling that primary member of your team that's not you to figure out what is stuff going to cost you, especially the deductible piece. Get them on the phone and write everything down. I did that because it's like, what is left of my deductible? And before I even had my surgery, my deductible was paid. And then I called them again. I'm like, okay, what's my 80-20 split? How much do I pay? And then they were, no, you have 100%. I'm like, excuse me? My plan had been grandfathered in, so I didn't even have an 80-20 plan anymore. And when I say 80-20, meaning your insurance covers 80% and you're left with 20% left over you have to pay after they've paid the doctor that 80. So I was expecting, okay, I got 20% to pay for. Mine was 100%. So I was sweet from surgery till on. Everything was covered. And that's because I called my insurer and asked, hey, how much is left on my deductible? I asked all these questions, so I already knew. So that's one member of your team. I would say get a therapist, because your family may love to hear you drone on, but it will get old really quick. Have a therapist so you could bounce things off of. If you need to cry with the therapist, cry with the therapist, because your family, they may be trying to be strong for you. They may be crying in the shower, and they may need to get a therapist too, but this is about you.
Right.
I would say get a therapist.
Can I give Frank an opportunity? I mean, we have a therapist right here. In what ways, Dr. Bavakwa, are you able to provide people assistance in kind of like what she's talking about there?
So I think I mentioned this on an earlier episode that we did. Just talking about this idea, like the cancer itself. No one in your family or friend group would think that they were capable of solving your cancer, right? There are specialists out there who do that. Your family and friends are probably not those people. And so, us as the person going through the thing, we don't expect our family or friends to solve that piece, nor do your family or friends feel pressure to solve that for you, right? Like, we know that if your leg was broken, same thing. They can't do anything about that. But if you're sad, if you're scared, if you're overwhelmed, if you're stressed, a lot of times we think that our family or friends should be able to kind of be there and support us through those things. And they probably want to be there to support us through those things. But like when we're talking about something that is big like this, right? At an extreme, it is a life or death thing. And it's not something that's short term, right? It's not something that's over in a day or a week. There's a longevity to that. It is unrealistic to think that your family or friends are going to be able to be there in a way that a professional therapist, counselor, psychologist, whoever is going to be able to be there for you. And if we don't include that person on our team, then we're left, relying on people who are not experts in it, right? There's a reason why, you and I each went to school for a very long time in our respective things. It's because this is what we do for a living. Your mom, your dad, your sister, your brother, your best friend, like they don't support the emotional heaviness, the weight of other people's lives for a living. So yeah, the sooner you can do that and the sooner you can recognize that is one piece of the team, I think it just kind of takes a little bit of pressure off everybody.
Gosh, I love this podcast, if for nothing other than the last few minutes that we've been talking about all this stuff. I'm so glad we finally got to it. So, okay, we got the insurance company, we got the therapist. It looks to me like we're on number 3, if I'm not mistaken. So yes. What's the third part of the equation for you?
I had 2 other members, or actually multiple other members on my team, acupuncturist and chiropractor. Now with chiropractic, it is different. There are some cancers where a chiropractor will not be able to treat you.
Right.
Okay, because they won't be able to adjust you. My cancer was okay where my chiropractor was able to treat me, because before all of this, I had ended up with an anterior shoulder dislocation, which got worse courtesy of the radiation and your arms having to be over your head every day for a month. So that was the one thing. They couldn't touch me until I was done with my radiation, because then they could put my shoulder back in place because it kept popping out. And trying to remember. And if you're like me, a lot of doctors, nurses, nurse practitioners, they will be inadvertent members on your team because they will call you when you least expect it. I had phone calls from my friends in Montana. A friend in England was sending texts. Friends on the East Coast, West Coast, they were just calling to check in on me, because some of them knew when parts of my family did not. My family found out. I told them right before my surgery, because we had a sudden death in the family as I was going through this.
Oh, gosh.
Yes.
Wow, that's heavy.
Mm-hmm.
So
And
on my list,
they weren't happy.
so on my list right now, as it would stand, I've got call the insurance, write a lot of stuff down, get a therapist, acupuncturist and chiro based on what kind of cancer you have and are you able to do that. And then I wrote down your version of what you said, which was allow your educated friends to call you and check in on you, right? That's important. Those people that know a few things. I'm sure there's more on the list, but I'm really kind of prompted to ask this question of you. And it was one that we maybe had on a podcast a couple of episodes ago where we got into this discussion about, were you the kind of person who shared your cancer with family and friends, and did everybody around in your inner circle know what you were going through? Or were you hush hush about it and nobody knew a damn thing until after it was all done?
My family didn't know because they're not in Arizona. I'll put it that way. My family, my friends who are family, they knew because they were in Arizona. Because they were, oh, I'm taking you to your appointment.
Got it.
Oh, I'm going to be here when you have your surgery. Because I was there when they had their surgery for a different cancer. So certain people knew, like, just keep us in the loop. And then as I let my family know after the death of another family member, they were like, why didn't you tell us? I'm like, because you guys had doctors calling me about this family member. And I'm like, I can't hit them with this because they just lost a sibling. So it was that. I told them, they took it in stride. They're like, okay, when do I need to come out? I'm like, nope, you don't need to come out. Because two of the aunties were ready to hop on a plane. I'm like, there's nothing you could do but stare at me. I will keep you updated. But they eventually were told. It just wasn't right away. Because sometimes when you tell certain family members, they could be very excitable. Or they go down the road of like, oh my God, they're going to die. Or, oh my God, it's going to be bad. So if you know you have that kind of family member, keeping it from them may be a good thing temporarily because they're eventually going to find out and they're just going to be mad. But that's okay because it's not about them.
And that's kind of what people have to remember, myself included, right? I get a little butthurt. I've had a few relatives who got cancer and I didn't know about it until way after it was done. And I was like, wow, I would have enjoyed meditating for you or praying for you, or I would have enjoyed a chance to be thoughtful about you or send you some well wishes along the way. And you damn robbed me of that opportunity. But, so I get it that it isn't about us. It isn't about what we're going through. And I've had to come to learn that with my best friend who's going through it now. And, at every moment I'm with him, I'm so present for him and just trying to step into what he needs and what, we can do to put him in a good mindset. He talks about the fact that like the cancer can never go away, like in his head, not, even after he was able to beat it and before it came back, it's like, it just was always there. Is it always there for you, or you have been able to set that down?
No, well, it's weird. I'm like, back when I was diagnosed with cancer and a couple of my friends like, oh, what is she talking about? Because it's like in the back of my mind that it was there, but it's like I'm moving forward. There is that fear, anyone that's been diagnosed and treated and come out of cancer being cancer free, there's that thought, what if it comes back? Or when or if it comes back? And someone has asked me that. They're like, what are you going to do if it comes back? I'm like, well, I guess I will fight with that too. Because a friend of mine had asked, what if it spreads to the other breast? I'm like, well, then I'll have a mastectomy and then I could get a new set, or I could just be footloose. And she was just like, only you would come up with that. I'm like, well, that's the only thing I could think of. It's like I could either cry in the shower or attempt to deal with it in my mind, like what could happen later on.
All right. So what's number 5 on your list after we've allowed educated friends to check in with us? Okay. What else are we putting on that list?
This is something for you. I would say create a binder where you're going to write out your health history, your surgical history, any medical diagnoses you've had, whether it's resolved or not. mental health history, any recent lab work, put it in that folder. What medications you're currently taking, what current supplements, vitamins, minerals, whatever are you taking? If they've given you your surgical documents, put them in the folder. Any allergies you have, because sometimes if you've never been treated for anything and suddenly they're trialing you on these different medications, an allergy may show up. Put all of that in a binder, a 3-ring binder, put everything in there. Also make a sheet of all of your logins, all of your logins and passwords. You can have this whole folder, digitized and a hard copy. And I would tell people, because I got my will done in 2020, full on will, where you have to name who's your power of attorney, who's all that other stuff. That folder, I put all my medical stuff in that folder. So when I was having surgeries and stuff, I would tell my friend, that's my power of attorney. I'm like, hey, it's this folder next to this book on this shelf. So if anything happened to me, she knew. She also knew who was my she was my medical power of attorney, but she also knew who was my durable power of attorney, the financial part. She knew who to call and their phone numbers. So make a binder, especially chronological of what's going on. So when you go to the doctor's office, one of the things that most of us hate, we have to keep repeating ourselves. What happened? How'd you get here? Instead of that, I'm like, here's a sheet of paper. Read it. That's something we used to do when I was an ICU nurse. If a patient was there longer than a week, we started to do a chronological of what happened, detailed. So now I've got mine down on one sheet. So if people ask, hey, what's going on here? I'm like, here you go. I will even upload it to their patient portal. So the doctors will always have it. So you could have that and you could just keep updating it as you go through. And that's one thing to have because you may not remember everything.
I wonder if this strikes you really quick. And allow me to interrupt, Dr. Frank. I want to ask you a question. I wonder if this strikes you too. Here's what she's doing. She's controlling the controllables. She's managing what she can. She's not allowing herself too much space to like wonder what if. She seems to be attacking everything. Like you could see where somebody would get cancer and they'd be like, oh my God, I got to do my will. Oh my God, I got to do this. Oh, I should probably write down what I'm doing. And people sit there and have that conversation all the time. But she did it. She literally kind of did the thing and moved herself forward. You and I have always talked about that piece of movement and just kind of keep going. So did that strike you too?
Yeah, it struck me as like a very, I want to say like a logical, but also like a very kind of solution focused attack, right? Like do the things that I can do. And, you know, I think the harder part for some people is let go of the things I can't directly control right now.
There it is.
But, you know, let's at least do the things that I can do. Because one, they need to get done. And two, it might make me feel a little bit better to be kind of productive and you know, get some things done along the way too. So.
Yeah. Okay. Good stuff. Okay. We're kind of winding down on our time, Dr. Kimara, but is there anything else that you really wanted to make sure that you mention outside of the 6 or 7 things you have so far?
Oh, back to the insurance piece. If you have a high deductible plan, whatever your deductible is, if it is possible for you, hopefully you have at least half of it saved in a savings account. Half or all of it, even if it's like $500, that could go to it. Because a lot of people, if they have a major medical issue and if they have a high deductible plan, how many people have $10,000, $15,000 sitting in a bank account?
Yeah.
Many people don't because of finances. But if you have a small amount of it, it could lessen some of that financial stress burden. If you get a major medical condition where you got to pay this deductible, pay that deductible, then you'll be able to pay things. But having a little bit of that nest egg sitting in your bank account or savings account under the cushions in your couch somewhere where you're able to pay for some things out of pocket. And if you don't have insurance, hopefully you have a little bit of savings, but you could always pick your doctor's office and ask them, do they have a cash payment plan? Because every single one of them does, because they know a lot of people don't have insurance.
Golly, I can't even imagine the cash price of cancer.
It would be astronomical, but depending on the office, they may be able to work with you and get you on a payment plan. Sure. Because you can't, in Arizona, we have access. It's Medicaid in Arizona. Some people think, oh, I have cancer, I can apply for access. If you make too much money, you're not going to get access. Mm-hmm. So your option would be, okay, if I still have my employer, can I afford COBRA? Can you afford COBRA? Is it enough? Some people choose to pay for COBRA for a couple months to get them through their treatments and then go into the cash payment plan with their outpatient doctors. Other people, they have access, but then you have people in the middle who can't afford either.
Yeah, sure.
So they figure it out. They may go to a school or go through, what are those things called? Clinical trials. A lot of people do things like that to get medical needs met. So things can happen. You just have to know where to look. And clinicaltrials.gov, if you have a condition, you could Google that, look, and it will tell you every clinical trial that's going on. And if you've got that condition, you could likely qualify for that trial. I've had many clients who were like, oh, I'm in this trial for lupus. I'm like, there's a trial for lupus? So, and that's what they're doing to get treatment because they couldn't afford it otherwise.
All right, Dr. Frank Bavak. Well, we got a lot of good tips here today. We got a lot of we got marching orders, legitimate marching orders for people that are really kind of in any medical situation, because what she's talking about pertains to pretty much everybody. Tie a bow on this thing for me.
Don't try to figure all of this out on your own. Like, there are other people who know stuff. There are other people who have been through these types of things before. And so whether you lean on them for like the logistical information of literally step by step, what do I do? The emotional support of like, okay, you went through this and you survived, how did you do that? I think for some people, the tendency is to kind of like shrink into yourself. And the more that you can include the right people on your team in that circle, it sounds like the better chances you got at being kind of successful.
Final thoughts from you, Dr. Kimara?
Have a good mindset. One of the things I wrote down, you have to be invested in your care. If you are not invested, your prognosis likely won't be good. You've got to be invested. You've got to do it because it involves you. You can't sit back and say, oh, this happened to me, I don't know what to do. It's like, nope, you're either going to go through treatment or you're not. And then based on what fork you go is going to determine what your outcome is going to be.
There it is. Somebody told me once upon a time that wellness is proactive, right? You must opt into it. So I love that. Well, we'll wrap up today with one of my favorite Buddhist parables. And I saved this one for you, Dr. Kimara, but it really is, it's perfect for the moment. But I'll give everyone the very short version of this, which is there are two monks and they are out on a walk and they come upon this river and this princess who is standing at one side of the river, and she's going on and on again about how she can't get to the other side because she'll get wet. And so these two monks, they offer to lift her up and walk her across the river. And as they do, she's just complaining the whole time. You're fast, you're too slow. There's this, there's that. And they get to the other side. They set her down. She goes off on her way. The two monks go off on their way. And about a mile down the road, the one turns to the other and he says, "Can you believe that princess?" And the other monk turns to him and he says, "We set her down a mile ago." You, in a lot of ways, represent that, Dr. Kimara. You had your diagnosis, you dealt with it, and you seem to have set it down. And I just wonder how many other people are still hanging on to things that they too have set down miles ago. And it's not serving him any longer to hang on to it, right?
Yes.
Well, listen,
drop what
appreciate
doesn't
that.
serve you.
Drop what doesn't serve you. All right, Dr. Kimara, thank you so much for your time today. I really appreciate you. How you educated us today, I think, right, Dr. Frank?
I learned stuff, but I learn stuff every time because, that's why I'm here. I'm here to be the person that everybody explains things really slowly to. So.
Oh,
we love you, man. We love you. All right, guys. Thank you very much for listening to Learn from People Who Lived It. We'll see you next time. Have a good day.
Bye.
Thank you.
We have 3 goals with Learn from People Who Lived It. 1, to help you feel less alone. 2, encourage you to seek out a coach, a therapist, a church, anyone who can help you get through your journey and find some healing. 3, when you're ready, share your story with us.
Find Learn from People Who Lived It wherever you get podcasts. Search it using all one word. Learn from People Who Lived It.
You've probably heard me say this before, but most of the things that kill us are preventable, and that's exactly why I put my heart in his hands, in his care. I'm talking about Dr. Robert Todd Hurst and HealthSpan MD. He's my cardiologist because I appreciate his holistic approach to heart health. There's nothing out there like HealthSpan MD, his AFib reversal program, his CAD reversal program. Get the link on the resources page at learnfrompeoplewholivedit.com.